I'm a health center. Because this is World Diabetes Day, I thought that I would go over the Inlows 60-second diabetic foot screening today and just go over some of the points to it and the reason that we're doing it, just to kind of catch any high-risk feet, and then if we need to refer off for further investigation. I'm sure that you know that there's about 3 million people or more living with diabetes in Canada right now. There are about 29% of Canadians living with diabetes or pre-diabetic right now. First, we'd like to start with looking at the feet to check for any issues with skin or nails. Just checking the top, the bottom, in between the toes, looking for any calluses that could be from pressure, blisters that could be from friction. Just checking to see if there's any cracks or fissures in the skin as well that could affect the diabetic for healing. I also have the model here that I'm just kind of showing because if there was any cracks or fissures, those kind of things to be looking for. The other thing that we like to look for usually is to check for any ingrown nails, thickened nails, fungal nails, anything that could cause any skin breakdown to the diabetic and make it high risk as well. So we go by the scoring of this assessment, and then at the end you can kind of see where they need to be assessed, maybe yearly, every 3 or 6 months. With the skin, if there's dry skin present, I'd likely advise someone on using cream daily. Diabetics are prone to drier skin as it is, so best to do it after a shower. You can trap the moisture, and it's better to use, I've just got a few here, a thick cream. A thicker cream is better. It just, our skin on the bottom of our feet is tightly woven, so a lotion will not absorb in as well as a thick cream. But that should be done daily. There are some creams with urea in it, and urea is good for the dryness, for a point, but you should only use it for a short period of time and then just go to a regular cream. It's only to be used when it's really bad. The next thing after that is to check for the sensation on the feet, which is to check for any neuropathy. So with the patient sitting there, we kind of get there's 10 spots on each foot that we check for, and just to get the patient to say yes if they feel it. And so we're just going to show you if you can feel it up here.
Yes.
And then if you can feel it down in these areas without looking, let me know, okay?
Yes. 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 Yes.
Sometimes you want to change it up on the other foot.
Yes. Yes. Yes.
So that's good. The other thing you'd like to check for as well is the temperature, which you use the back of your hand and check between the top of the foot and the leg to make sure it's the same. Another thing I like to check for while the patient's eyes are closed is the proprioception, to see if they can tell me which way I'm pressing the the toe, if the toe is going up or down, and which toe I'm touching. Okay?
Up.
And which toe is that?
My baby toe.
Yep.
Down big toe. Up second toe.
Right?
Down fourth toe.
Good. The other thing that also should be checked for is for vibrational sense with the diabetic neuropathy. So we use a tuning fork, just kind of get it going. You find a bony prominence and you hold it against there and see if they can feel it. Yeah?
The vibration?
Yep. Yeah,
Yeah.
good sensation. All right. And now the other thing too is to ask the patient if they're having any problems with numbness, tingling, burning sensation. Those are all signs of neuropathy. And if there's no problems, we go on to the next, which is just check for the pulses in the feet. So we check for a few spots on the feet. On the top of the feet, there's a couple of spots here that we check. We also check behind the ankle here, and that relates to the back of the leg, just to see if there's a pulse. Not everybody you can find it on. Now there are times where you can't seem to find the pulse, so you use the Doppler. And we use that, and then we can hear the flow of the circulation in the feet. And that's good. The next thing I'd like to check for is dependent ruber. You see how the foot is lying, or just as it is right now. So we try to elevate the leg and see if there's any change in the color in the toes. They should stay like a normal pink color. And then down again. Now some people that don't have very good circulation, you'd see a color change here, which could be white, waxy looking, but normally it should be like a pink color, so you know there's good flow. And then also when I was checking, with the temperature, just to make sure that it's not a cold foot as well. Some diabetics will say they feel a cold foot, but we don't feel it like that. So it's good to do the assessment on here. So the next thing I check for as well is any foot deformities. So we have a look at the feet. Now you can see there's quite a high arched foot there, but we look for any problems with even like the starting of a bunion, the high arched foot, any clawing of the lesser toes, any previous amputations. Those are all like risk factors for the diabetic as well. Also the Charcot foot. Then we also would check for the range of motion in the big toes to make sure that you're getting close to 90 degrees on both of them, because you want to have that for good propulsion with walking. Some people may be like a rigid toe where you get no movement at all. So there could be callus buildup, which is leading to pressure that could cause skin breakdown down the road. So we need to kind of assess all those things. And then if we go on to footwear, we want to like assess the foot the way it is and hopefully be able to advise them on better footwear if they don't have appropriate footwear to accommodate the foot. I have a pair of shoes here just to kind of show you different features to look for. Not just particularly this brand. It's always good to try 3 or 4 different kinds on when you go to the store to get the right fit. It should always be measured. Best time to go is at late afternoon when the foot's naturally swollen. So the features, you want to make sure that you have a good heel counter that's stiff enough to hold the foot in place. Should always be a lace or a strap to hold your foot in place. The toe box should be, if you're measured, the right width to accommodate, and there should be enough room in the toe box there. And also, when you do measure, when you put your foot in, your foot should always be a thumb's width from the end of the shoe. It should never be crammed up against the end of the shoe. Another important feature on this pair, which is I tend to like, is it's got like the rocker sole. As you can see the angle there. So it just helps with propulsion for walking. This makes it a lot more comfortable. So those are the features that I would look for in a pair of shoes, but it's worth it to always get measured before you get a pair of shoes. when we're talking about neuropathy in the feet, and you do come across a patient that has lack of feeling in their feet, I tend to recommend wearing a white sock, because if they can't feel anything, at least if they took their sock off, they would see blood or pus, and know that there's something going on with their foot. The other thing that I like to recommend is to get a mirror, so that they could put it on the floor and just have a look at the bottom of their feet every day, just to make sure there's no cuts or bruises. And if there is, they can contact their doctor or nurse practitioner and get that looked at right away. I hope that this has been helpful, so that we can all of us practitioners can try to do this yearly, or it could be every 3 or 6 months, depending on the assessment tool and the score with the patient, so that we can help be preventative and reduce any risks of infection or amputation. Thank you.